Hi, everyone. Hi, everyone. Thank you for joining IVF Dr. Bayrak's webinar tonight. We are a fertility clinic offering a full range of infertility treatments with 4 locations in California. The topic today is understanding your fertility. Dr. Bayrak will talk about IVF and treatments. My name is Sarah. I'll be your host tonight, and we want this to be as interactive as possible. You can send us your questions by typing them in the chat box or the Q&A box any points during this presentation, and you will receive 20% off on this IVF cycle or egg freezing by attending this event. Let's welcome Dr. Bayrak, the medical director, founder of IVF.
Hello, everybody. Good evening. I'm Dr. Bayrak, as Sarah mentioned, and welcome to our webinar. I would like to welcome everybody. It looks like we have a number of participants, and I think we have more joining us, but I think for the interest of time, we will get started as we may have questions coming in. So anytime you have a question, please type it in the question and answer box or the chat so that we can get those questions and we can answer them for you immediately. I would like to start by telling you a little bit about our clinic and so that we can explain to you how we do things and what we do, and talk about infertility in general, and then spend some time answering questions. So I'm the medical director of IVF, a full service IVF clinic, and give me 1 second. Let me just arrange something here. Okay, wonderful. So, all right, perfect. Okay, wonderful. So we are in 4 locations in Southern California, and I am actually you from our West LA location tonight. We also have clinics in Pasadena, as well as satellite clinics in Chino Hills, and as well as San Diego. So you can be treated at one of those locations. And when it comes down to your egg retrieval or embryo transfer, those are typically done at our West LA location. We provide all medical and surgical treatments for infertility, including inseminations, hormone treatments, evaluations, surgical management of infertility, such as tubal disease, endometriosis, tubal reversals, hysteroscopies, laparoscopies, pretty much anything that applies to infertility and its treatments. Tonight, I just wanted to talk a little bit about infertility and touch base on IVF for about maybe 10 minutes. And then we would like to make this an interactive session. So please, if you have any questions, go ahead and start typing them into the chat, and I'll answer them as we go through the process. Also, let me remind everybody that you do qualify for a complimentary consultation because you're attending the seminar activity tonight. And also to reiterate, you also get 20% discount on your treatment when it is IVF or egg freezing. It doesn't apply to surgical or other type of treatments, but rather if you're doing IVF or egg freezing, we will offer you 20% discount because you're attending the webinar activity tonight. Let's talk about infertility a little bit. Infertility is typically defined as a couple trying for about a year without any success of any pregnancy for somebody who's less than age 35. So the American Society for Reproductive Medicine, which is our governing body, recommends that we do the infertility testing for a couple in which the female partner is younger than 35 after 1 year of trying. And if the female partner is over 35, then the recommendation is to do the testing after 6 months of trying. And the reason for that is if a couple has been trying for 6 months, and let's say, for example, the female partner is 40 years old, the chances that that couple is going to get pregnant the following 6 months, which would then complete the full year, would be quite low. And that's why the recommendation is based on the basis that time is of essence in such cases, and basic testing should be done. Not necessarily treatment started, but at least the basic testing done to better understand what the underlying cause might be. And the basic testing for infertility includes 3 tests, really. One is a semen analysis done on the partner, male partner. And this is done typically through a sperm collection after a few days of abstinence, which is then analyzed. We offer the semen analyses in our laboratory, in our own laboratory, and typically the turnaround time is 24 to 48 hours. And that tells us about whether there's a sperm problem. The second test is to check the fallopian tubes and the uterus of the female partner. That test is called HSG, or in long terminology, hysterosalpingogram. This test allows us to examine the inner lining of the uterus, make sure the uterus is healthy to maintain a pregnancy, and also to check on the status of the fallopian tubes. Because if the tubes are blocked, or if there's a problem in the uterus, those can be issues that can lead to infertility. The last piece of the puzzle is typically related to ovulation or hormonal problems, as well as the egg reserve. And for that, we do a pelvic ultrasound on the first few days of the menstrual period, as well as examination or checking of the hormone levels. And the information that's gathered from the hormone levels, as well as the ultrasound findings, are then used to better understand if there is an ovulation problem or whether the egg reserve is adequate, high or low for that age group. And the process typically starts with a consultation, assessment of risk, understanding what the needs are, followed by the semen analysis, the HSG tests, and the ultrasound and hormone testing. And those tests are then gathered and evaluated and reviewed, which is then followed by a follow-up consultation so that we can talk about what may have been the issues along the way, what can be done, whether there's any need for advanced testing. And we also talk about treatment options at that time. And then with the following period, typically the treatment is then initiated. And the treatment is really based on the underlying cause of infertility, because we want to treat the underlying cause rather than just treating infertility itself. Let me talk about IVF in general, and I think that may be helpful because that's one of the most common treatments that we offer. As just some of you may know, IVF stands for in vitro fertilization, where we fertilize the eggs in a laboratory environment. Naturally or physiologically, the eggs will be fertilized in the fallopian tubes. This time it happens in a laboratory, and that's why it's called in vitro fertilization. For in vitro fertilization, a woman has to take hormone injections to stimulate the ovaries. This is called controlled ovarian stimulation, which takes about 7 to 10 days. Injections are typically in the evenings, sometimes in the mornings, or a combination of the two. Over those 7 to 10 days, patients are followed with ultrasound examinations and hormone measurements to determine how many eggs are developing and when those eggs are becoming mature eggs. Once those eggs are mature, then those eggs are aspirated vaginally under anesthesia. And on that same day, they are then mixed with sperm. Typically, sperm is injected into these eggs, and overnight they get fertilized. Once the eggs are fertilized, they're called the embryos. Then they're developed for about 5 to 6 days in the culture systems in our own laboratory. At the end of those 5 to 6 days, the embryos can be tested for genetic or chromosomal problems using a type of test called PGT, pre-implantation genetic testing. Then the embryos are selected based on their quality. And if this test is applied, which is optional, the chromosome makeup of each embryo can also then be determined. And the test looks at the chromosome numbers, whether there are 46 chromosomes or not, provides the gender information, testing for chromosomal issues such as Turner syndrome, Down syndrome, issues that may result in miscarriages or major syndromes or malformations. This test is limited in the sense that it cannot look at every single disorder. We also don't know how to search for certain specific genes or disorders that may result in unusual or unfortunate outcomes. But it still provides a lot of information and allows us to select the embryos better if the embryos are looking the same under the microscope and we truly don't know which one to put back. So it's a great tool to understand which embryos are normal or abnormal, but certainly it's not a must at all. IVF also comes in different forms. There's conventional IVF, there's mini IVF, there's micro IVF, and natural cycle IVF. We may not have a whole lot of time today to discuss different types of IVF and how that would impact somebody's outcome. But the regular IVF is stimulation IVF in the sense that a person would use injections to develop multiple eggs, because the more eggs we have, higher the chances, because more embryos will be formed and more chances will then be available to choose from. Mini or micro IVF refer to lower stimulation IVF, where we get limited number of eggs, limited number of embryos. That may be appropriate for some cases. And the natural cycle IVF is no medications, just going with the natural flow and the development of typically one egg. And the rest of the process is the same with fertilization and the development of the embryo and eventually transfer of that embryo into the uterus. So let's take a pause here and see if we have any questions at all. Please feel free to send in your questions. Anything that can be specific, it can be just about a general topic. If you'd like me to explain anything in more detail, please feel free to send your information right now. So let's see here. All right. All right, so there's a question coming in here, and it says, can a patient opt for twins through IVF? That's a question that came up. The short answer is yes, you can opt to have twins with IVF. That will require the transfer of 2 embryos at the same time. As you know, each embryo has a chance of implanting into your uterus. So if you like to have twins, then you have to transfer 2 embryos. We typically discourage that approach these days compared to perhaps 20 years ago, which was more of the norm, putting in even almost up to 3 to 4 embryos at the same time. Because back then, the only goal was to get a patient pregnant. These days, we do concentrate on getting you pregnant, of course, but at the same time, we would like to make sure that the pregnancy results in a healthy outcome, a live birth, without any complications. So when you transfer 2 embryos for the purpose of having twins, or to increase your chances, that's sometimes obviously a request, there are certain risks with twin pregnancy. You can have miscarriages, you can have 2nd or 3rd trimester early labor or late miscarriages. If there's preterm labor, and if labor starts very early, for example, at 23, 26, 28 weeks, typically the twins are very small at that stage, and they can have significant complications. And that's why we discourage patients from transferring to embryos. Now, there are certain circumstances where 2 or even 3 embryos can still be transferred, but those are rare. And those are typically cases where if a couple has done multiple cycles and they have failed multiple cycles, certain situations where the embryo quality is very poor despite repeated treatments, then multiple embryos can be transferred. But once again, one has to understand that the risks are there for twin pregnancy, and we try everything to minimize those risks. There are also other risks with twin pregnancy. For example, the blood pressure during pregnancy can go up. We call that gestational hypertension. One can develop diabetes during pregnancy. We call that gestational diabetes. Sometimes the kidneys can get involved when the blood pressure goes up. That's called preeclampsia. And these can lead to dangerous complications and kind of major issues. Also, the risk of having cesarean delivery is increased. So all these risks are certainly increased with the transfer to embryos, which is not the ideal way to do it these days. But there are certain exceptions to that rule that would justify putting into embryos, as I mentioned a little bit earlier. So hopefully that was helpful and I answered your question. Let me go back to the second question here. And the second question is, what type of IVF is recommended for a woman over 40 years? So if somebody's over the age of 40, typically conventional IVF is recommended. What that means is stimulating the ovaries with injectable hormones called FSH, which stands for follicle stimulating hormone, or egg stimulating hormone. It's the same thing, because the goal is to develop multiple mature eggs within one cycle. As you might know, the ovaries will provide us a group of eggs each month, but in a natural cycle, only one will be released. So we only ovulate from one egg. And then the rest of the eggs, they're not there to stay for months or years. They will collapse at some point in the following weeks. So in a way, they're like wasted eggs. And in that sense, because they're wasted and they're not going to be saved or returned back into the ovarian reserve and preserved for many years, because that doesn't happen, it is logical and recommended to stimulate the ovaries so we can obtain multiple eggs, because each egg has a chance of being chromosomally or genetically normal. If you have only one egg, we only have one chance. If you have 5 eggs, well, there's a good chance that we're going to have one of them come back normal genetically. And if you have 10 or 15 eggs, it's almost guaranteed that we're going to find one good one. So when we do IVF and stimulate the ovaries in somebody above the age of 40, and also below the age of 40 for that matter, what we're trying to do is maximize the number of eggs so we can increase the number of embryos we create in order to find that good quality embryo. Now, that question is a little broad in the sense that should everybody do conventional IVF over the age of 40? I think that would be a good question to kind of expand on. And the answer is no. If somebody does conventional IVF and if their response is very adequate, great, but they just got unlucky and they didn't get pregnant, another cycle with conventional IVF is the way to go. Now, if somebody does IVF in the conventional method with the full stimulation, but because the egg reserve is just so low and the response is so poor that we're only able to get only 1 or 2 eggs. Now, in those cases, one has to consider what the benefit would be of doing conventional IVF and spending a lot of money on medications and using high-dose medications. And the rationale there is not to do that, because if we're using all these injections and we're only getting 1 egg, for example, or only 2 eggs barely, then I think a mini IVF minimal stimulation IVF, micro IVF. These are all terminologies, but the bottom line is not stimulating the ovaries as aggressively as before, then becomes a great option. And that option is to do natural cycle IVF, because if we're only getting one egg with stimulation, pills, injections, that's almost like a natural cycle. So if you're only getting one egg, then why use all these drugs and hormones and put them into our body, where we can also get one egg during a natural cycle? So in those cases, we start talking about doing natural cycles. Oftentimes, you also take the approach of changing the protocol, thinking that maybe in the second cycle, we'll do better and we'll get more eggs. But if we're on the extremes where we're only getting one egg, then going into the natural cycle or mini IVF or minimal stim IVF makes much more sense. And the success rates in those particular cases appears to be the same. Having said that, if somebody is developing multiple eggs, 5 eggs, 6 eggs, 10 eggs, then conventional IVF is much better than any other type of IVF in that age group. Hopefully that was helpful for the person who was asking me that question. All right, next question is, do you have experience for your patients have success in one cycle IVF for the person over 40 years old? Is it true more than one cycle IVF have a higher chance to be successful? So we have experience with only one cycle IVF all the time. We also have experience with patients come in and do multiple cycles because we see a variety of patients. One size doesn't fit all, unfortunately. We have a number of patients who have recently gotten pregnant with just one IVF cycle. We have a patient who was 45 not that long ago who just came in, did one IVF cycle, did PGT testing. She had about 5 or 6 embryos, if I remember correctly, but only one of them came back normal. Everything else was abnormal, which is actually not unusual at age 45. So we transferred that one embryo at age 45 after just one IVF cycle. And she got pregnant, and it was a healthy pregnancy. We have a 44-year-old who had that not that long ago. And we have a number of 38, 40, 42-year-olds who get pregnant after one IVF cycle. Now, that doesn't mean that that happens to everybody. Majority of the time, actually, a person about the age of 40 will need more than one IVF cycle. And the reason for that is, statistically speaking, the chances of getting pregnant about the age of 40 is less than 50% per IVF cycle. So statistically speaking, if you think about it, the chances that we're going to need more than one IVF cycle is greater than 50%. So most women above the age of 40, once again, just statistically speaking, will need more than one IVF cycle. But some will only need one cycle, and some will need more than 3 cycles because their egg reserve is just simply too low. The remaining of that question was whether there's more chances with additional IVF cycles. And the short answer is absolutely yes. There's a British study that was published a number of years ago. They looked at continued IVF tries. I think it was up to 9 cycles, if I remember correctly. I can dig that up for any interested readers, and I can email them to you if you like. But with continued IVF attempts and tries, they were able to show continued increase in the pregnancy rates overall. We call that cumulative pregnancy rate. So if somebody failed after 2 cycles and they did 3 more, their chances would be much higher with additional tries. And once again, one size doesn't fit all. That doesn't mean that everybody has to do many, many cycles to find that good egg embryo. But as long as you're developing eggs, creating embryos, you always have a chance. That approach has to be individualized because some patients may have a very high chance with additional tries. Other patients may need to stop, take a break or pause, and talk to their infertility specialist about alternative treatments. So once again, everybody's different, and we just have to individualize that type of a care. But the short answer is yes. With additional tries, the pregnancy rate overall goes up. Let me go back to the Q&A session here because I think there are 2 questions here. One is, are any egg retrievals done in Pasadena or exclusively in West LA? our laboratory and our tissue bank, as well as our operating rooms and procedure rooms and our recovery suite, is located in our West Los Angeles location, which is in Century City next to Beverly Hills area, at the corner of Olympic Boulevard and Century Park East. This is our largest location where we do everything, including the egg retrievals and transfers, surgeries, as well as any procedures that require anesthesia. If the procedures such as fluid ultrasound or insemination, ultrasounds, blood draws, coordination, pre-post consultations, follow-ups, nurse visits, blood draws, semen analyses, and insemination treatments can be done in the other locations. But for the egg retrieval and embryo transfer procedures, all of our patients from all of our locations, as well as out of town, out of state, out of country, and we treat a lot of out of country, out of state patients, they come to our West Los Angeles for their procedures. These procedures are done very early in the morning. Oftentimes we start as early as 6 a.m. in the morning. On the weekends, we're open on Saturday and Sundays by appointment. And the egg retrievals and routine appointments on the weekends are also held at the West LA location. So, and if the egg retrievals on a Sunday or Saturday, once again, that is done at our West LA location. So hopefully that was answered. The other question to that following question here says, do you know of any medical insurance that cover any of the costs for elective egg freezing? The short answer is yes. All insurance companies that provide PPO type of an insurance would have a policy, and these insurance companies, they'll have like hundreds of policies. They would have policies that would cover elective egg freezing, which basically refers to egg freezing without any cancer that is coexisting at the same time. That would be elective egg freezing for pregnancy that will be desired in the future. All depends on the policy. Interesting enough, a lot of the studios, and we have quite a few in the greater Los Angeles area, as well as tech companies, have actually started covering for elective egg freezing treatments. And they do offer policies that cover those type of treatments. We take all major PPOs. So if a patient is interested in that, we can provide information. We also obtain authorization from your insurance company to make sure that we know all about your policy, your benefits, co-pays, and deductibles, and we do provide the information to you in advance. So if you have an HR person in the company you're working for, that would be the best person to speak with. If you're an individual getting your individual insurance, oftentimes they don't cover elective egg freezing, although there are some policies. You just have to search and find. All right, so those are the two questions we covered here, and then let's go back and continue answering our questions here. The question was, again, the next question here is, can I choose the gender of the child? You can. The short answer is you can. That is provided by the test called PGT. Pre-implantation genetic testing, when you do IVF, allows you to identify the embryo, whether it's a boy or a girl. And if you're balancing your family, let's say you have two girls, you can have a boy. If you have two boys, you can have a girl. So you can certainly choose the gender through PGT testing. The next question is, what is the success rate live birth, in parentheses, of IVF at age 38? How many eggs need to be collected to get at least 2 viable PGT tested embryos? So the pregnancy rates are based and reported off of the female reproductive age only, which unfortunately is a very poor way of giving you guidance about pregnancy rates. So when you're 38, your pregnancy rate might be 5% if you have severe male factor and if you have very low egg reserve. Whereas if you're doing family balancing or gender selection, your chances may be 90%. The average is, I would say, around 40 to 50%. If you have good quality embryos, you test the embryos that are genetically normal, we should expect at least 40 to 50% per embryo transferred. When you're testing the embryos, you might be increasing that chance because you're only putting back a chromosomally normal embryo, so you can increase that by another 50%. But the most important thing is that average number of 40 to 50%, which is a very rough number, by the way, is an average number. So if you include all 38-year-olds into that same column, some of those patients may have an ovulation problem. Some of them may be doing something electively. We can have a single woman or an individual who's trying to become pregnant. And we have individuals who are using a surrogate. We have patients who have very low egg reserve or very high egg reserve or ovulation problem or complex infertility. So all of those are unfortunately grouped up into that age group, which makes it very difficult to kind of put yourself into that scale from 0 to 100, where the average is about 40 to 50%. So are you right at that average? Are you above the average? Or are you below the average within that entire group? If you give us a chance to examine you and evaluate you and do the testing, we can actually understand where you're at within that range, within that scale. And you can say, well, the average is maybe 40 to 50% in your case, but unfortunately, you're actually at 10 to 20% because these are all the major problems you have. Or we may say, well, you're just on average because everything looks pretty much good. Or we can say, well, you really have a minor problem. This is very easy to fix. You're going to be above average. So we can actually kind of tell you where you're going to be. It's just we cannot give you an exact number. We can't say your chances are 54.5%. I mean, that's obviously not realistic, but we can kind of have an idea where you're at within that. All right, hopefully that was helpful. Let's go to the next question here. I'm sorry. The second part of that question was how many eggs do we need to get 2 PGT normal embryos? Typically about 10 to 15 eggs in order to get 2 PGT embryos. Once again, for an average outcome, if we're in the extremes where there are dramatic issues, we may need more eggs. If there are minor problems, then we probably need even fewer eggs to have 2 PGT normal embryos. Also depends on the specific case. Next question here is, do you do egg retrievals on the weekends? Oh, yes, absolutely we do. We're open every day, including Saturday and Sundays. Saturday and Sundays are by appointment only, meaning if you are just calling in to get an appointment for a new patient consultation, for example, for a Sunday, we don't provide that. Although once a month, on a Saturday, we provide new patient consultation, so that's available. For elective appointments like semen analysis or just blood draw or just a routine ultrasound or something, we do those on the weekdays. For any treating patient, any actively treating patient, Saturday and Sundays we see patients. We also do egg retrievals, IUIs, egg freezing, sperm collection, fertilization, biopsy, everything every single day, meaning we're open every day, but on the weekends it's by appointment only for treating patients. And that's in our West Los Angeles location, as I may have mentioned this before. The next question is there a way to improve egg quality with a diet, supplements, and exercise? That is a very common question. It's always best to keep a balanced diet. It's always best to keep a healthy body mass index, which is based on your weight and height, mainly based on the weight, because we cannot make you shorter or taller. So that's not something that I can change, but we can change your weight. So if you're underweight, you may need to gain weight. If you're overweight or obese, which is much more common, you may need to balance your diet, increase your exercise activity level, and lose weight so you can bring your body mass index down to a reasonable number. Keeping a good sleep pattern, at least 6 to 8 hours a day and night, is always recommended because sleep pattern, immunological system, and reproductive system, they all work hand in hand. So that's extremely important. Managing stress is extremely important, especially in this day and age where we have the cell phones and a fast-paced lifestyle. In addition to that, COVID all the additional stressors, economically, family, everything else, it can add up. So managing stress is one of the most important things, both for men and women. Last but not least is exercise. You must keep a exercise program, even if it's walking for half an hour a day, every 3 days, every 5 days, or every day, once a week, whatever it is that you like doing, but it must be something that you like so you can maintain it. You must do exercise, and that can be going up and down the stairs, stretching, yoga, weights, aggressive training, running, any kind of sports activities, anything that's going to increase your heart rate would be beneficial. That's also good for stress management. So all of these are things that we can do to improve the egg quality. There's no a drug or surgery or any kind of wonder supplement that's, you can buy off the internet, although there's a lot of supplements out there that are being promoted, right? There's really no such thing that's all of a sudden going to change your egg quality. But if you have bad habits like smoking, excessive alcohol use, drug use, clearly, excessive stress, if you have any medical conditions, if you have any psychological issues, all of those must be treated, which will eventually and ultimately improve your egg quality. I would also emphasize the fact that the diet is extremely important. So try to keep a balanced diet. And if you don't have a balanced diet, you should take vitamins or fertility supplements. One supplement that we typically recommend is called the Fertile Vitamin for women. It's a prenatal formula plus antioxidants and other ingredients that may be helpful. That's available through our clinics. You can purchase that. For men, there is the Fertile Vitamin for men. You can actually buy it on Amazon, or it's also available through our clinics, or we can ship it to you if you call us. Even if you're not a patient with us, we can actually ship it to you wherever you live, and we ship all 50 states, obviously. So those are the things that you can do to improve your egg quality. Hopefully that answered your question. Let's see here. Next question is, do you have a preference recommendation for patients to be on or not be on birth control pills when doing the hormonal testing? So you can do hormone testing while on the birth control pills if you're on the birth control pills for a short period of time. So birth control pills will suppress your hormones. If you've been on the birth control pills for a long time, meaning you've been on it for 10 years or 20 years, then yes, your hormone levels will be suppressed and affected. You have to stop the pills, wash off the effects of the birth control pills, and then test your hormone levels. That may take 2 to 3 months, as a matter of fact. But if you just started pills a month ago, or you're starting them because you're preparing for IVF, you can measure your AMH hormone. That'll be very accurate. If you're on the birth control pills, the 2 hormone levels will not be accurate, called FSH and estrogen levels, because they'll be low, and that may be false low. So those 2 hormone levels should be typically measured when you're not on the birth control pills. So hopefully that answered your question. And the other question is, can you exercise during the injection IVF stimulation process? You can in the first part of the stimulation. Up until the 4th or the 5th day, you can exercise. Any type of exercise is fine. After the 5th day, typically the ovaries will get swollen. And once they're swollen, you want to avoid any impact activities. There's a very rare complication with IVF. It's called ovarian torsion. That means the ovary twists, and it can cut off the blood supply to the ovary. That's an emergency. That's almost a surgical emergency where you have to have surgery. So that's called ovarian twisting or ovarian torsion. And that's very rare, but that can happen sometimes. If your ovaries are really heavy, you're stimulated, you have multiple eggs, and you're doing impact activities where the ovary is just simply twisting. That is one thing that we try to avoid. And that's why after the 5th day of ovarian stimulation, when you do IVF, impact type of activities should be limited to just walking up and down the stairs, totally fine. Driving, obviously, normal home or office-based work is totally acceptable and fine. Yoga is okay, stretching, light weights, upper body, all of that is fine. But anything impact or racket sports, martial arts, any extreme sports are not recommended when you are doing IVF or injecting hormones. The other question we have here is, what is the correlation between thyroid issues like Hashimoto or infertility? The thyroid gland is closely associated with the reproductive system. It is not uncommon that we see thyroid disorders in women with infertility. If you have Hashimoto's, that can result in the inflammation of the thyroid gland. It's an autoimmune disorder. That can result to hypothyroidism, which means the thyroid gland is not producing enough thyroid hormones to maintain normal bodily functions. That can affect fertility. It can affect the health of the child if you are really hypothyroid and you're not treated, because the baby gets the thyroid hormones from the mother up until the 12th week. Also, it can lead to ovulation dysfunction. Women can have ovulation problems. That can even lead to an immunological issue in the body, because it's an autoimmune disorder, and it can activate the immune system, or it can result in other reproductive issues, such as declining ovarian reserve, because if somebody has low thyroid function, and if that's an autoimmune issue, and if it's affecting the ovaries, that can also lead to low egg reserve. And we do see that oftentimes. So anytime you have any kind of questions about thyroid disease, you should get tested. And the commonly measured hormone level is called TSH, thyroid stimulating hormone. That will pretty much tell us if you have hypothyroidism or not. And people use different cutoffs, but if the level is over 4, and if you have infertility, that should really be treated. If you have miscarriages or history of thyroid problems in the family, or you have thyroid disorder already and you're on medications, you want to make sure that your thyroid level is, TSH level is less than 2.5, up to 3 may be acceptable, but less than 2.5 is kind of considered the sweet spot in a way, as long as you don't have side effects, of course. So, and that can be titrated by your infertility specialist or the medical endocrinologist or your internist, so that you find that optimal level for thyroid supplementation. But certainly that can affect fertility. That's very significant. Let's see if we have any other questions here that we can answer. Okay. All right. Well, it looks like we may have answered. Oh, here we go. There's one more question here. Is embryo freezing more effective than egg freezing? Yes, it is. Embryo freezing is a little more guaranteed in a way, even though nothing that we do is guaranteed, unfortunately. When you freeze eggs, you're freezing a single cell, a very large cell, that can be vulnerable to freezing and thawing. We have a lot of experience in egg freezing. I have been involved in a number of egg freezing studies myself for the last 17 years, 18 years, including my training years. We have a number of publications. Our laboratory director and our clinical staff and our laboratory staff have a very reliable, impeccable, I should say, track record for egg freezing and thawing and success rates. But still, egg freezing is still tricky compared to embryo freezing. And the reason for that is when you freeze the eggs, you have to thaw them. And when you thaw them, the survival rate is not as high as embryo survival rates when you freeze and thaw an embryo. For example, if you freeze and thaw an embryo in our laboratory, we are seeing about 98% survival rates. So about 2 out of the 100 embryos that we thaw may not survive. They may not be due to the freezing and thawing, and sometimes it's just the embryo quality, by the way, but nevertheless, it's 2%. With the eggs, it does vary. Oftentimes it's close to 90-95%, but we've seen rates of 70 or 80% if the egg quality is low. So it's just not about freezing and thawing, which is extremely important, by the way. And actually, thawing is as important as freezing, but also what we're freezing, what we're thawing. Because if the egg is not healthy at the time of freezing, that egg is not going to thaw well. Even if it thaws well, it may not fertilize or result in a healthy pregnancy. So freezing and thawing is one thing, pregnancy is certainly another. Now, compared to that, embryo freezing, you take everything to the final stage with embryo freezing because you're fertilizing the eggs fresh. So you're not losing anything to freezing and thawing. That's number one benefit. Fertilization rates tend to be a little higher. You can also take the embryo to the final stage, so it makes it more predictable in a way. Furthermore, you can test the embryos with PGT to check if they're chromosomally normal or not. And if you don't have enough chromosomally normal embryos, you can then freeze more embryos while you still have the time and healthy eggs and embryos. Or if you have only one, and if you want to have 3 kids, then you're going to have to freeze more. Whereas if you just froze eggs, you kind of don't know what you're going to get in the future. So egg freezing is a little less predictable than embryo freezing. And that's a whole nother discussion that we can talk about for another hour, by the way. But I think just to give you a summary, that's probably the shortest summary I can give you. The other question comes in relation to the final question, which was, what is your clinic thaw rate for eggs? Ranges between 70 to at about 100%. All depends on egg quality because we use the same technique, same protocol, same straw, same solution, oftentimes the same exact person. Our lab director actually does hands-on work in our laboratory in order to our additional embryologists. So it really depends on the egg quality. If somebody says, what's the average? I would say probably 80, 85%. And that's a very conservative number. So oftentimes people do better. So hopefully that answers your question. Let's go back here and we're going to be wrapping things up as a matter of fact. So we got only 1 or 2 minutes left in this webinar activity. First of all, I would like to thank everybody for joining us because that has been actually a very nice interactive session. And we had a lot of wonderful questions, very stimulating questions. And I really liked answering these questions, actually. That's really fun. So thank you for that. Let me also just remind everybody to call our front desk tomorrow after 9 o'clock in the morning. You can call any one of the locations and schedule your complimentary or free consultation with me. We typically offer Zoom consultations, just like the Zoom webinar that we're doing right now. The difference is obviously it's one-on-one, it's private, and I'll be able to review all your medical history, records if you have, go ahead and send them in. Schedule that so that we can speak with you. And if you need any additional testing, I'll order that. And then we'll have another conversation so that we can understand what the underlying cause of your infertility is, or whether you need a different protocol or a different approach. We're able to offer that. We do a lot of second, third opinions in our clinic, so we'll be happy to do that as well. And let's not also forget that if you have attended this seminar and you have sent in your contact information, you do qualify for a 20% discount if you do IVF or freeze your eggs. And you sign up for treatment within the next 3 months. So let me just make sure that we don't have any other questions here. And I think that's pretty much it. So I think, Sarah, we are pretty much going to wrap things up here. Thank you so much for being a great host, as usual.
Thank you, Dr. Bayrak.
We're always here. Once again, contact us. Go onto our website, laivfclinic.com. so that you can sign up or request your consultation, and look forward to talking to every one of you, hopefully in the next couple of weeks. So thank you so much. And Sarah, it's all on you right now.
Thank you for your time, Dr. Bayrak. This has been extremely informative as always. And to our audience, thank you for joining us. If you would like to learn more about us, please visit our website, www.laivfclinic.com. And remember, you will receive 20% off on IVF cycle and egg freezing by attending this event.
All right, I
Dr.
think,
Bayrak, I have a question. Sorry.
oh, sure, yes, absolutely, of
I
course.
was busy typing the vitamin website. I'm not sure that if you answer, there's one at 6:42. Can you exercise during the injection IVF simulation process?
Yes, actually, we did answer that, Sarah. Yeah,
Okay, perfect. Sorry, I was just busy
we
typing.
did answer that. And yes,
Just wanna
so
make
the
sure.
vitamins are available on the website
Yes.
or through our clinics. Patients can call directly, whether you're our patient or not. You can order the vitamins, it doesn't matter. And we can ship them to you. The male fertile vitamins available on Amazon. And all other vitamins are available through the website called fertilevitamin.com or through our offices. So, all right. Well, thanks again, everybody,
Thank
and
you.
have a good evening. And we hope to see you in our clinic soon. Bye-bye.
Bye.